Good afternoon, everyone.
Good afternoon.
Hi, I'm Regina Anderson Rush, and I'm from Family and Children Association. Thanks for coming out today. I'm from Family and Children. We're one of the largest not-for-profit agencies on Long Island. This is our 141st year, so we're around a long time. This program is just one of many, many programs that the agency has. It's within our senior division. And the program is called Alzheimer's and Dementia Caregiver Support Program. So what we do is support caregivers through a New York State initiative that was developed about 9 years ago. And we work in conjunction with Parker Jewish Institute, and they get the grant from the state, and then they actually have some subcontractors who come out and do programming, education. I'll go over everything we do at the end. How many folks have someone that they know or in their family are taken care of with dementia or memory loss? It doesn't even have to be diagnosed, right? It's just memory loss in general. It's very difficult. And hopefully we can have an interactive session today and workshop. I have a PowerPoint that I'm going to go through, but please at any time if you would like to ask a question or you have a comment, please be free to do that, okay? I just want it to be interactive. I'm not one to just talk at people for an hour, right? So I want it to be interactive. And so I'm going to start the program. And if you don't mind, I'm probably just going to sit to do it. So it's called Unraveling the Mystery of Dementia, Causes, Symptoms, and Treatment Options. And what I told you before is FCA is a not-for-profit on Long Island. We have many programs, and our mission is to assist Long Island's most vulnerable. And we have many senior and adult programs. Unfortunately, most of them are in Nassau County. This program is the only one in Suffolk County from seniors. So, memory, forgetfulness, and aging. What's normal and what's not, right? That's a big question everyone has, even now. We go out to all different places, and people of all ages have been saying, I have memory loss. I think it's really the stress of the world at this point. People coming off COVID, they have some extra symptoms of forgetfulness. But we're going to go over what's normal and what's not. So many older people experience a little forgetfulness. I say it's almost everybody that experiences that. Who walks in a room and forgets what you walked in there for every once in a while, right? Maybe you ran into someone you haven't seen in a pretty long time, and then you might forget their name. I'm sorry that my back is to you folks. Or, where are my keys? Those type of things. That's normal type of forgetfulness, right? It's you worrying about things that maybe you're forgetting and thinking, oh no, do I have a problem? But if you have recall, eventually you'll recall what you're doing. Normal aging, the difference between that and dementia or a diagnosed memory loss is that dementia is memory loss that affects your daily life, right? Your inability. Hi.
Can't hear you.
Oh, I'm so sorry.
Have you got a mic?
I don't have a mic.
You want to sit up closer?
I could try to speak louder. Okay. So what is that okay? Or do you need a mic? Do they have one here? Okay, so what I was saying is that memory loss, the difference between regular memory loss and dementia is that people who have dementia have memory loss that affects their daily life. It affects their ability to do things that they normally would be able to do, right? So we're talking about ability to bathe and dress and maybe go to work or take care of your daily tasks at home. Your ability to maybe drive a car, pay bills on your own, remember to prepare meals for yourself, and all of those things. So when you have dementia, you're losing, not all at once maybe, and maybe it's a little at a time, but your ability to do things on your own diminishes. And that's a big difference between regular memory loss and dementia. So, taking on new things and learning new things. People who have dementia are not able to learn new things, right? The things that they forgot, they may never remember again, and they're not able to learn new things. So when you have someone who has dementia and you're trying to prompt their memory or say, don't you remember so-and-so? Remember when we did this? It's a futile, task, because they're not going to remember all of those things. Once things are lost, they're generally lost for the rest of their life. The difference is that if you forget things every once in a while, it's normal. If you keep forgetting the same thing, like how many people know someone who repeats the same thing over and over and over, the same story over and over, and every time you see them, or even if you spend an hour with them, you've heard this thing now many, many times. That is a sure sign that the person is having a memory problem. Maybe it's cognitive impairment, maybe it's a diagnosed dementia, but we don't know, because the evaluation to determine dementia is not just, I'm going to tell you 3 words and see if you remember them. It's blood work, it's CAT scan, an MRI, emotional and mental evaluation, those things like remembering words. Thank you, Colette. So some of the things that may prompt you to talk to a doctor about is getting lost in places that you know. Can you hear me? Okay. So getting lost in places that you knew how to get to. You've lived in the same area for...
Sorry. I didn't know you'd come back.
You've lived in the same area and driven to the same places for 30 years, and all of a sudden you get in your car and now you're like, where am I going? How do I get there? And this is a lot of things that we hear people are doing. Or a family member, a spouse goes out, and next thing you know, either they're getting a phone call from a place or someone's driving the person home and saying they were lost. And that's a sure sign that someone is experiencing more than just a little memory loss. They're actually getting lost. You've made a recipe. It's your family's favorite for 30 years, right? Every holiday you make this recipe and you go to make it and now you don't remember what ingredients go in there. See these little things, it might seem little, but if you look at all of them together, like you have someone who's forgetting normal things, forgetting how to get to places where they normally do, or you go to a loved one's home. We get a lot of calls after the holidays because families visit during the holidays, and they're saying, I talked to them on the phone and they're saying that they're doing really well, but now that I've come to visit, we notice that there's really not a lot of food in the refrigerator. We notice that their clothes look like they might have worn them for quite a long time, and maybe they're soiled, or they don't look like they've been taking care of the house, or, just things have gone awry. And those are all the telltale signs that there's a problem, right? It's not just, I forgot I forgot where I put my keys. Also, behaviors. Some behaviors like your decision making is in question. Like, it's winter, it's 30 degrees out, but you're going outside in shorts. Or, things of that nature where you're making decisions that could be unsafe for you. And recently that happened, like about, I guess it was last winter, where someone who had some dementia wandered out of their home, and unfortunately, it didn't end well because they didn't know how to get home, and they ended up, somewhere where they froze or something. And it's those type of decision making that are in question. Like, okay, you should know that if it's 30 degrees out, you bundle up, you wear a little extra clothing, and they just cannot get that together. So the dementia umbrella, a lot of people think that common thought is that Alzheimer's is the umbrella and dementia is under them. It's actually the opposite. Dementia is the umbrella and Alzheimer's is just one dementia. There are many different dementias. Some of them you've seen in the news recently, right? Bruce Willis has dementia and he has a certain kind of dementia. We have Alzheimer's is the most popular. Although I don't see that in in practice, like when I go out and do all my assessments, I don't see that Alzheimer's is the most common, but I think it's the most commonly thought of, actually, because Alzheimer's is just a very specific dementia. You have vascular dementia, you have Lewy body, frontal temporal, and they all come with they're similar symptoms, but then each one has a very specific thing. Lewy body comes with aphasia, where you're having difficulty talking. Other ones may come with the inability to have a filter. So maybe if you see someone who's not acting like themselves, you know, they're saying things that they normally would not say. That's a specific type of dementia where you're losing the filter that you have in the front of your brain. Any questions? Anybody think that Alzheimer's was the main umbrella and dementia was under? Yeah, a lot of people do. It's really because Alzheimer's is the most commonly, thought of the dementias. So some symptoms of dementia, some will vary, some will be the same. There's at least 2 of the following core mental functions must be impaired to be considered dementia: memory, communication, and language. Very often someone who has dementia is losing the ability to communicate. You'll see some people start isolating. A lot of times people may not know what's going on with themselves, but they're realizing that maybe they're not keeping up with conversation as much as they used to. Or maybe, like, I know people play cards here, mahjong, maybe they're not really keeping up with the game as much, and they might not know what is going on, but they're realizing, I'm feeling uncomfortable in social situations now because I don't feel like I'm fitting in as much. You'll see people isolate just because they feel like they're always trying to keep up or catch up with conversations, or they don't like a lot of noise, like say, family gatherings. You see people who have dementia stop wanting to go to those things because all of the chaos and noise and everyone's like, hi, and they might not remember their loved ones' names, like especially the kids. Usually you'll remember the names of people who have been in your life a very long time, right? Because your memory of the long past stays with you longer than recent past. So your short-term memory is the first to go, but your long-term memory usually stays. So tend to think like, maybe the children, you don't remember all of their names, or maybe some of the kids you might think of who their parents were. You might confuse them with like their parents because they maybe look like their parents when they were that age, and maybe your memory is back there. Ability to focus and pay attention. One of the first things to go is ability to manage finances. Money is generally one of the first things that you lose. Ability to manage finances and pay bills. We'll see a lot of family members come to us because they've seen that their parents maybe were paying the bill too many times or not paying bills at all. Or some, like you have a couple and one spouse was the person who did all of the finances, but now that person is not able to, they're making mistakes or they're just confused, not able to write out checks, not able to do banking. That's a very common thing that we see is the finances. Oops, hold on. Visual perception is another one where you're thinking things are much closer or much further away than they actually are. So this causes a problem with depth perception, and especially in driving. We'll see that people are stopping short because they think the stop sign is very close, but in reality it's a little further away. This is also a problem with some people for on and off an elevator because their depth perception, or on and off a curb, or getting into a shower, because they cannot get the depth perception right, and it looks like they might fall like into a hole. It they can't see where it actually stops. So they're afraid. I had a client once that would not get on and off an elevator. And, no matter, even if her husband was with her, she thought that she was just going to fall down into a hole. She couldn't get it to be, reasoning in her head that the floor was right there. It just didn't look like that to her. Is dementia reversible? In some cases,
You talked about, your depth perception.
Mm-hmm.
Well, I'm losing my eyesight. I have no depth perception, mid-range or close up, but that doesn't necessarily go along.
No. In your case, that's a vision problem, right? I'm talking about a person, right? But yes, you're right. I'm glad you brought that up. That alone does not mean that you're getting dementia. It just, why you're having depth perception issues, right? So thank you for bringing that up and clearing that up. It does not mean just because you have that you might have dementia. It's just one of the symptoms that you could have. So, is dementia reversible? Actually, in some cases where it has all the symptoms of dementia, it looks like dementia, like a UTI. That's a huge, huge thing for us. When someone tells us, my mom, she's really experiencing memory loss, she seems confused, she's even hallucinating, all of these things, and it came on so fast, I always ask, has she been to a doctor? Has she been checked for a UTI? Because dementia-like symptoms, confusion, all of those things I just mentioned, are symptoms of a UTI. It's also a symptom of things that can be reversed. So it looks like dementia, but it's really not dementia where it's permanent. So once the infection clears up, generally the memory comes back and those symptoms go away. The same thing if you're having a bad interaction with drugs, like you're taking new medications and they're interacting poorly. Sometimes you could also have that symptom where you're a little confused, where your memory is going. But once they feel like they realize that the drug interaction is not good and they change whatever medication they gave you, then your memory comes back, your confusion clears up. But that is one thing that I always tell people. I'm like, before we jump to conclusions and say that it's dementia, let's make sure that it's not a medical issue that actually can be cleared up.
What is UTI?
A urinary tract infection. So that, for some reason, it's so many of our clients that actually experience that. And it's very happy for us when it does get cleared up, the infection gets cleared up, and we realize, that's all it was. Also, things like delirium and depression can cause dementia. And those two things, once they're treated, can also reduce the symptoms of dementia. And also when you're deficient on certain drugs, like on certain vitamins in your body and nutrients like vitamin B12, once you're deficient in that and they realize that with some blood work, that's why I said when you're trying to be evaluated for something like dementia, it's much more than just talking to the person. Blood work, because then they can say, you're really deficient in your B12 or you're deficient in D or whatever, and once they get that back up to normal level, maybe your symptoms would clear up. So delirium is a state of confusion that comes on suddenly and can last for several hours or days, and they include difficulty focusing and thinking clearly. And some causes include medication side effects, lack of sleep, and infection. A lot of my clients, sometimes when they go into a hospital, have experienced some delirium because you're in a new environment. Whatever you're in the hospital for has affected, your memory, it has affected your mood, and sometimes you've been experiencing some delirium. A lot of people, it's lack of sleep as well. when you are sleep deprived, that could actually affect a lot of things in your body. So we have another workshop that's sleep and dementia, and how sleep can affect dementia. So the delirium, often onset during hospitalization, rehab stay, or another unfamiliar environment. Some people get very confused when they go in, and thank goodness that when they come out of the hospital and rehab, it takes a while, but they usually get back up to par. Because it's, if you've ever stayed in a hospital, it's not an environment for rest and peace, right? You have so much going on there. As soon as you fall asleep, they're in your room to do vitals again. It's just nonstop. A lot of times it could be people moaning and this and that. So you're really not getting as much rest and sleep. So once you come out, we always say, let's keep an eye on the person and see how they feel after they come out, and see if their symptoms decrease a little. Depression is a mood disorder that causes serious symptoms that affect how you feel and think. So some symptoms are serious enough that they affect everyday functioning. You ever known anyone to have depression and sleep all day? They don't take showers, they don't want to get dressed, they don't want to participate in any social activities, and they seem like their mood is not to take care of themselves, not to cook, not to do anything for themselves. And this may cause thinking and memory problems, but if you can get help. Depression is not normal for any age group, right? So I've heard way too many times that a caregiver will say to me, I went to the doctor and I said, I think my mom is depressed. She doesn't want to get up. She just wants to lay down. She wants to sleep all day. And the doctor said, oh, what do you expect? She's 85. No. Who thinks that's a good answer? Right. It's not a good answer at all. Just because you're 85 does not mean you should be depressed, does not mean you should be laying in bed all day and not wanting to participate. We have people who are over 100 still coming to centers, still participating, still happy, not laying in bed. And so that's not a good answer, and that's probably time to maybe think about a different doctor. But that all these symptoms of depression could appear also as dementia. But it's not true dementia.
Stress has to do something with stress.
Test?
Stress.
Oh, stress. Yes. Oh my goodness. Yes. Stress, like I said earlier when we talked about memory loss, right? Stress can bring on all of these type of things. Forgetfulness. If you're stressed out, sometimes you become immobile because you're so stressed you can't really get yourself together enough to do things. And let's face it, things have been a little stressful recently, right? It's this time of the world right now where it could be a little stressful. We just went through a pandemic, now we're coming out, it's winter. Some people have seasonal types of depression and stress because it's cold and it gets dark early. We also had, fall back, and so it's getting dark at 3:30, 4 o'clock in the afternoon now, and some people, they just tend to maybe not want to go out as much. So stress can definitely cause a lot of these things. So Alzheimer's. This is a progressive degenerative disease. It affects a person's daily functioning, causing issues with memory, thinking, and behavior. It represents 60 to 80% of dementia diagnoses. And it's the most common dementia in people over 65. Like I said, to be honest, with all of the assessments that my program does, I don't find that. I find that has a mind of its own over there. I find that Alzheimer's is not the most common diagnosis that I see in my program with our clients. I see dementia as the most common. But an Alzheimer's brain compared to a normal brain. Now you can see, here's a healthy brain, and here's a brain that's been affected by Alzheimer's. Do you notice that the brain is much smaller? That there are spaces in between where brain matter was, and now it's not any longer? And it is not reversible, unfortunately. They're striving to try to find a cure, and they're coming close. They're they're developing new things every day, new drugs, and some other in clinical trials and all of that. And we've had some luck with some in the past, about 2 years, where they've had some luck with some of the drugs that they've come with. But so far, nothing can reverse it at this point. And we're hoping that, in our lifetime, that happens. So, age of onset. The typical age of onset is 65 and over, but Alzheimer's disease is not, just like dementia, not to be a part of normal aging process, right? Not at all. Younger onset can occur. We have seen early onset dementia quite frequently recently. Mostly people in their 50s and 60s, and I feel like that's very early onset. I thank God I have not seen anybody in their 30s and 40s in our program, but it does happen. In the United States, it's estimated that 200,000 people have early onset dementia. So here are some warning signs of Alzheimer's. And I feel like it's Alzheimer's and or dementia. Memory loss that disrupts daily life. Challenges in planning or solving problems. So generally, with someone who doesn't have dementia, if a problem arises, you have the ability to think through what I can do to solve this problem, right? You could do games, you could do puzzles, you can do problem solving, quizzes, but with a person with Alzheimer's or dementia, that is not the case anymore. They cannot think that deeply into something. I feel like it's the tasks. I always say keep it simple because they cannot follow. Like, I have clients, I've been blessed to run support groups with both people who have been diagnosed and caregivers. And so with the people who have been diagnosed, one of their main things is they cannot follow a set of directions. So if their spouse says to them, honey, can you please go to the shed and grab that tool that I need to, plant these flowers. Oh, and on the way back, can you also grab my garden, my garden hose and this and that. And they have like 3 or 4 sets of directions. They get to the shed, literally get to the shed, and they don't know what else comes after that. They can follow one thing, maybe 2. Maybe they'll remember what else, but they cannot follow that set of directions. So there's no way that they can solve a problem because that's also something that goes in steps. To solve a problem, you have to have some steps involved. They can no longer do that. And here is difficulty completing familiar tasks at home, work, or leisure. And that's something that they have difficulty with. Things that they've always done. Things that they've always done around the house, things that they've always done for their job, they can no longer do and or no longer do at the level they did it. And that's frustrating to them. Confusion with time and place. They generally don't have that much of an idea of what's the date, what's the time. They can't recall that. And so what we do is we always tell them, and if you have any loved ones that have this issue, a calendar right in front of you is such a good tool to have so that you always know, what day is it, what do we have going on that day, because that's another thing they complain about is that they have, they're dependent on somebody else to always tell them, what are we doing today? What do I have going on today? And so that's why I always try to keep them as independent as possible and keep a calendar. Also for the tasks, just because we talked about it, I always told them to keep like a Post-it note or a pad with them so that they could write all the tasks down, because generally you could read until very late in the disease. Oh, guys, tell me when I'm losing this. Uh-oh. No, it just goes into sleep mode. Trouble understanding visual images and spatial relationships. We went over that. New problem with words, speaking, or writing. A lot of times, person with dementia will not be able to recall a word. We teach a lot of workshops, and one of them has a testimonial from someone, an expert in the field, who said that they were at an assisted living and they were having like a coffee and tea hour with donuts, and a person came over and he's like, "Oh, may I have one of those?" and couldn't recall what he wants. So he said, "May I have a brown round?" So you'll notice that people who have dementia will think up other names for things to describe what they want, because the name has, just disappeared from their mind. He couldn't think of donut, so he called it a brown round, and you'll see that a lot where they get crafty in what they call things because they want to still communicate, but that's one of the things to go. And especially some of the dementias, they have a harder time with getting names of things. Misplacing things. Misplacing things is, of course, one of the first ones, and I think that everybody can misplace something, but this is that it's never to be found again, or I don't know when you would find it. I had a client, it was a couple, and they lived in senior housing, and the wife was at the point in her dementia where she was hiding things. She was taking things and placing them. Not that she was playing a hide and seek game, but she was taking things and just placing them other place. And she took the rent envelope, and he never found it ever again. So it could be serious, sometimes it could be okay and it's not something that important, but other times it could be very serious. Decreased or poor judgment, withdrawal from work or social activities, and changes in mood or personality. We generally see that a lot of people tell us they would never act that way. They were the most docile person, but now, they're aggressive, or now they're saying things that they normally wouldn't say. Maybe things that aren't very nice to people, that they wouldn't want to hurt their feelings. But that's not that person, it's the dementia. That's just the disease. It can change who the person's personality. So treatment options. There's no cure to cure the progression of Alzheimer's. There are a lot of medications there to treat the symptoms and behaviors, and some of them you might know the name of, Aricept, Namenda. There are a lot of them now on the market, which gives, not everybody reacts the same way to each medication, right? So it might work for somebody and not for others. So there are a lot of different options to being able to give someone. They say it doesn't slow it down. For us, it seems to maybe slow down the progression. It definitely does help with some of the symptoms.
Excuse me,
Yes.
just go back one sentence or so. You mentioned something about changes in mood
Mm-hmm.
and such like that. What about anger?
Yes, definitely. So we see that someone can be angry, and it's mostly out of fear, because they're fearful. They don't know what's happening. Things don't seem right to them anymore. They can't communicate as well as they want to anymore. They're frustrated because of that, and sometimes it can come out in anger. And it's unfortunate, but that's why we have some support groups for people who've been diagnosed with early on, so that they can really, express themselves. We've expressed the loss of independence can make someone angry and frustrated, because now, they used to be an accountant, and they used to be able to drive anywhere they wanted, and they were an independent person, and they were the head of the family, right? And now they can't work anymore. Someone's taking care of everything for them. They have to rely on somebody else to drive them everywhere. So there's a lot of frustration, fear, and anger that can come along with this disease. And, if it gets to the point where we call it dementia-related behaviors, where you could have anger, you could be combative, you could have sundowning. There's a lot of different behaviors that come along with some dementia, some people who have dementia, and anger is definitely one of them. If you can figure out, it's really hard for the caregivers, and I always tell my caregivers it's not fair and it's not an easy job, because you're the only one who can make changes. The person who has been diagnosed cannot make changes, cannot learn how to deal with themselves more. It's the caregivers and the people in their lives that need to maybe learn what is a trigger, which is a better way to handle the situation, to go along with the situation. Like I said earlier, keep correcting or trying to, prompt them to remember and try to get back that memory often are triggers for someone's frustration, possible anger. But if you meet the person where they are, maybe they're in 1970 right now. Maybe that's where their memory is right now. So, or maybe they're asking for their mom, but meanwhile their mom passed away 30 years ago. Instead of constantly correcting, don't you know your mom passed away 30 years ago, and doing that and having the person relive that trauma all over again, just meet them where they are. Because if you think about it, someone who doesn't realize that their loved ones have passed on and you are telling them over and over, it's like the first time they're hearing it. And there are ways to divert someone's attention away from that. So if they're asking for their mom, you can say to them, why don't we talk about your mom? What was your favorite memory with mom? What do you love that she cooks? What are some things that you love to do with your mom? Like, you could always try to divert attention away from that they want to go to their mom. A lot of things happen where people say, I want to go home. They are home, but they want to go home because that home doesn't seem familiar to them anymore. They remembering a home from probably when they were growing up, not the home they lived in for the last 30 years. So I have a client who, after a lot of group counseling, she said, okay, let's go home. And they got in the car, they drove around the neighborhood, pulled right back into the driveway, and she's like, okay, we're home. And he got out, and the situation was over at that point. So I know it's unfair, but it's up to the caregiver and the loved ones to learn all of these little techniques that make better situations and make, less triggers. And I think that's part of, why people are angry who have dementia, because of fear, anger, frustration, loss of independence, not able to communicate as well. And unfortunately, the only way to deal with that is to try to kind of solve their problem, right? What's the problem at that moment? They can't communicate that maybe they're cold. So we have to figure out what's wrong, right? Just figure out, okay, are you hungry? Are you cold? Are you tired? Do you want to lay down? Are you bored? Sometimes they're bored. That's why we always encourage maybe a daycare, something where there's activities built around people who have some memory loss, but they're still active. And they're not just sitting in front of a TV all day and, just watching TV and then they're up all night. They might have the days and nights mixed up. All of these things are just things to think about. We have a lot of workshops. We have support groups, virtual and in person. And you learn a lot from others who are going through what you go through. You learn a lot. Because some people it's like, they've gone through this already. So they said, you know what, I've gone through this already. Some things work, some things don't. They might give you the name of a book that is great that they read and it gave them some peace. So I always recommend that. Groups are one of the best things that you can do for yourself. Really, not just for being a caregiver. Support groups in general, for anything that you're going through, you can find a support group for anything, believe me, especially virtually. Hi.
There's not too many, there's really no support groups locally around here.
I run a support group the first and third Thursday of the month in Mastic. It's only about 20 minutes from here. And we have virtual support groups. We have some during the day. We have some virtual support groups in the evening. But I know that we have one in person. Also, Ronkonkoma is not really around here, but there's a daycare in Ronkonkoma called Day Haven, and I know they have some caregiver support groups there as well. But if you want, I have a sign-in sheet. If you want, I can always, send you resources. We work with all of the Alzheimer's and dementia caregiver agencies. we're not in competition with one another. We work together because, you know, if someone has a support group here and our closest one is in Mastic, we want you to just attend a support group. Doesn't have to be ours. It could be any of our, you know, our partners. Hi.
Just a piece of information, there is a day haven in Port Jefferson.
In Port Jeff. Okay, so, right, so they have support groups. I know that they do.
And they have some bus transportation too.
We love Day Haven. We have a lot of our clients who go there.
I actually spoke to them yesterday, and they don't have support groups for, they only deal with caregivers
Right.
for their support groups and stuff like that, not for.
Oh, were you talking about a support group for someone who's been diagnosed? Okay, that's different. I can find out for you. The one we have is in Amityville. It's far from here. But they run side by side, so we have the caregivers in one room and the care recipients in the other. But I will find out, and I could email you one that's the closest.
The one by the Greek church. That's what you're talking about.
So here's one of the drugs that came out recently, I guess in 2021, and they had a lot of good experience with this, but then they also had some negative side effects. So it's still going, and it's definitely something to speak to the doctor about. So diagnosing dementia, I explained before that it's extensive. This is an extensive evaluation. It's very comprehensive, and before an actual diagnosis can be given, they should go through all of these steps. It's also ruling out other causes of cognitive changes. And it may require appointments with a physician to get an accurate diagnosis. There's a health exam, a physical exam, neurological assessment, mental status assessment, blood and urine analysis, electrocardiogram, CT, or MRI. I don't know if any of you know, but Stony Brook Center of Excellence is part of the New York State Caregiver Initiative, and they have a big program where they do clinical trials out of there, they do evaluations to determine diagnosis, and they're a really great bunch of people. We work with them. They used to have a waiting list, but I think they hired another social worker, so they were trying to minimize the waiting list. But they're right in Stony Brook, and they are the closest center of excellence that you have. The other one would be in Mineola, so for Nassau County. And early diagnosis is key. I'm not sure if anyone is familiar with clinical trials, but these are drugs that have not been approved, but they do have clinical trials with them. If you fit into the criteria, they're running definite, like, it's mostly with early diagnosis and early diagnosis people with dementia. Hold on, you got it? Oh, okay. And you can get onto a clinical trial. We have so many of our caregivers who have done that with their loved ones. And we had one person who was a speaker at a caregiver conference for Alzheimer's Association a couple of years ago. She got on a clinical trial, and she's been 10 years diagnosed. And he said for like the first 7 years, she pretty much was, very stable and not much of a decline, and only the last couple of years. So no one really knows if she didn't go on a clinical trial what her decline would be, but there are some people who are very happy with doing clinical trials. You can go on the Alzheimer's Association, it's alz.org. And they have a whole section for clinical trials, and Stony Brook Center of Excellence also has a whole division on clinical trials. They're running them, but you have to meet the criteria. And also, early diagnosis is really important because it gives the person who's being diagnosed, it gives them time to tell their loved ones and what maybe their wishes are, and be a part of their treatment and be a part of their future planning. Because some people, they want to be involved in what's going to happen to them. Maybe they don't want to go in a nursing home. Maybe they do want to go in a nursing home. Maybe, they have their wishes. And a lot of people do want to be involved in that. And, you know, if you're diagnosed early, the family or the person, their spouse or the loved ones can be around that person and say, you know, what is it that you want? Did you want to have, a lot of people want to stay at home, but some people don't. They don't want to be a burden. They say, you know what, if this happens to me, a memory care unit is somewhere where I'd like to be, so I don't feel like I'm a burden to my family. And it's always good to have that person be involved in their own treatment. And it's also a good time because you could address safety issues. So sometimes dementia you have to do because people wander. You know, it's a good time to maybe think about safety in the home. Maybe take away loose scattered rugs if they have that shuffle going on, because a lot of times people who have dementia get like a little shuffle where they don't lift their feet all the way off the floor. I personally think that's a depth perception issue because, you know, like I said, they can't grasp, you know, how far down it is. So they have that little shuffle going. So maybe loose rugs aren't the best thing for that person. Or maybe they might need a lock on the top of the door, you know, like one that you put all the way up so that person won't be able to get out and wander. And other safety issues, maybe handicap accessible bathroom, or, you know, maybe stair rail. Just things that like you might have to think about in the future. And I would recommend this to every single person of a certain age and 100% of everyone who's dealing with someone who has memory loss. Get your legal issues, all your legal paperwork in order. You know, power of attorney, all of your advance directives, because that's so important, especially with people who have cognitive issues. You won't be able to access that if once they are diagnosed. They're no longer able to make legal decisions for themselves. Like they won't be able to sign even a Medicaid application if they're not cognitively they're not okay cognitively to say that's what they want. And if you don't have a power of attorney and you don't have access to that person's finances, it's going to be really difficult for you if and when you had to apply for Medicaid or place them in a nursing home. Hi.
I imagine you would suggest living trust,
Yes, all
power
of the
attorney and a will.
all of the advance directives. It's really important, especially with someone who has a loved one with memory loss, because you're going to be responsible for making decisions for that person. We've had so many people who didn't trust anybody. You know, there was an old-fashioned way of thinking that they didn't trust to tell their kids and this and that, and now they're having difficulty because they have to go for guardianship. It just makes it more difficult to care for the person. And so it's something that I think needs, you know, you could meet with an elder care attorney. There's also Nassau Suffolk Law Services that can consult with you for free. Because I know sometimes, you know, attorney fees can be up there, but there are places that can do there's places that can do a Medicaid application for free. Nassau Suffolk Hospital Council does Medicaid applications for free. So, and that's including like doing a pooled trust and all the things that go along with an application. Also, for caregivers, this is up until 9 years ago when caregivers were lobbying Albany. This is all unpaid, right? So caregivers are giving of their time for their wives, their husbands, their mothers, fathers, their neighbors, their loved ones. They're caring for themselves. They had to quit jobs. They've had to move back in with parents. They've had to take early retirement, you know, all of these things. And that's why New York State developed 9 years ago the New York State Caregiver Initiative, because they heard the cries of caregivers. So this program is solely to help caregivers in their journey. It's not like a lot of people don't want to have the caregiver role taken away from them because they feel like they made a vow to do that, or their parents cared for them. Now it's their chance to care for their parents, and we want you all to care for your loved ones, just with a little bit of help, right? Because you can't really do it alone. 24/7 caring for someone who has dementia or Alzheimer's is a big job, very big job. It's exhausting, overwhelming, and a little bit of help goes a very long way. Some respite is in order where you can take a break, you could get some help, you can go out for a little while. We have a lot of programs. Parker, through the New York State Caregiver Initiative, we have $1,800 towards home care, daycare, or a short stay in a facility. We have respite through volunteers where it's like a friendly visitor that can come in a few hours a week and sit with your loved one, and they're trained in dementia care, so you can go out, you know, for a little while. You can go to sleep, you could do whatever you want, but it's a couple of hours where you can feel that you could trust the person spending time with your loved one. It's also support groups, virtual and in person, workshops. We have short-term individual counseling if you need it. Maybe you don't think you're ready for a support group, but you really need to speak to somebody. So all of these things. And they have joint enrichment programs. These are really fun. They're all around the island, and they do it in Nassau and Suffolk. And what they do is it's a nice lunch in a restaurant, there's live music, and you bring your loved one. You and your caregiver and the care recipient go together. Some people dance. You'd be really surprised. You know, I've had clients that I've met them on their assessment, and the person who has been diagnosed with dementia is just sitting there. And I had one couple in particular, that she was upset because she said she didn't expect in her 60s to be going through this. You know, they were supposed to retire and travel all over now after retirement, and you know, it was very devastating. He didn't want to, he wasn't motivated to do anything. I think he was having a little depression where he didn't really want to get dressed, go out, or do anything. And I suggested that they maybe go to a memory cafe, which is one of the joint enrichment programs. And so a couple of months later, I referred them to Parker and, you know, all the programs. A couple of months later, I walked into a memory cafe, and there they were. And I went over to say hello. I was like, hi, I'm so happy you're here. And she stood up and she's like, Regina, I just have to tell you, you changed my life. You saved my life. I feel like we're on a second honeymoon. We go out to memory cafes 3 days a week. We're dancing. I feel like, you know, I have a new lease on life. And I was just so happy to see that that was happening, because I suggested they go and I knew it would be good for them, but to see that she really did go, they really were having fun. She had a whole new set of friends because they met a lot of people there, and so they were socializing now 3, 4, 5 times a week. They also have drum circles, and those are really fun too. So their memory cafes, drum circles. Parker has a lot of really great programming virtually. They come out with something at the end of the week for the following week where they have health and wellness. They have nutritionist talks. They have the month of January every day at 10 o'clock, at 10 a.m. They have some sort of programming. They have elder planning. They have all sorts of really good programming. And it's really good to sign up with some of those and just check them out. Everything is free. Everything we do is free from New York State Caregiver Initiative. And so we have just a lot of good supportive programming. Hi.
Hi, I really enjoyed the music and memory program. Have
Yes.
you ever seen those?
Mm-hmm. Those are awesome.
Yeah, so I signed up, and my mom died when I was with breast cancer.
Oh, I'm
just
sorry.
like Paul McCartney. So I thought that was identifying, you know, but it was a happy program.
Good. I'm glad you went. I love the music and memory, because music is one of the last things that you lose. They've had so many studies on people who've been nonverbal for years. Nonverbal for years. Don't talk to anybody. They're just sitting, and they'll put on a song of their like childhood, like you said, like you love Paul McCartney, right? He brings a lot of happiness to you, memories of mom. And the person will lift their head up and start singing the words. So there's a stored memory in there for music, and it's really beautiful because you feel like, you know what, the person is there. They're still, you know, able to remember the song and sing along. So that's why the memory cafes are so beautiful, because people get up and dance, and it's really nice. It's really a good thing to check out. Oh. Sorry, guys.
shoes.
So, does anybody have any other questions about our services? I'm going to be here for a few minutes and I have some giveaways on the back table here. But I also, if you would like anything, if you need some more resources or information, just let me know, give me a shout out, or sign into my sign in sheet and I can send you whatever you need. I can email it to you. Thank you, everyone. Thank you so much.